Talent promotion, are we here? Gambia talent promotion? Oh, they're here. Oh, Aisha is not here. Okay. Are we set to go? Get Fadu. Awa. Awa. Are we set? Because I'm from Numia. Okay, you are discriminating me. Okay, no problem. So we are already sorted. All of you, and thank you for coming. And as usual, it is a daily press briefing by the Honorable Minister to give you an update as to what we are doing, what we plan to do, and the activities we also accomplish. So it's a daily routine, and we are also happy that you are always with us. So now the Honorable Minister will read the statement. Honorable, thank you also for your time, and thank you for accepting to read the statement on a daily basis. This shows that you are interested in ensuring that information is taken to the public at the right time, and because of your commitment and dedication to duty, you are also being encouraged to follow your footsteps. So we are happy to have you, and we also want to hear from you. You're now welcome to read the statement.
Thank you very much, Mr. Njai. Good afternoon, ladies and gentlemen. It has become customary to update you on the most recent developments regarding our response to the COVID-19 pandemic. The following are the updates since the last update, which was yesterday, 30th March. A total number of 14 samples were tested, and they all came out negative. Out of these, 2 were repeat tests conducted on the first case and also the third case currently on admission. Both cases will be retested in a day or 2 for confirmation of recovery. That means if the 2 tests are repeated again and they turn out to be negative, the 2 individuals will be considered to have recovered from COVID-19. So we are awaiting the second test for each of those individuals. For a confirmed case to be declared as recovered, there should be 2 consecutive negative tests. Samples have been collected from the 5 people who completed their quarantine period, and the decision on their release from the quarantine facilities would depend on the laboratory results. Samples have also been collected from 2 quarantined individuals who manifested symptoms similar to that of COVID-19. Cumulatively, the country still has a total of 4 COVID-19 confirmed cases and 1 probable case. 2 of the confirmed cases are currently receiving treatment at the MRC Gambia Medical Facility, whereas the latest confirmed case is receiving treatment at the Government Treatment Center. All 3 cases are responding to treatment both clinically and psychologically. As a country, a total of 97 laboratory tests have been conducted to date, out of which 92 were negative, 4 were positive, and there is a single probable case. In addition to that, a total number of 247 persons have been placed on quarantine, and 168 contacts have been traced and have been actively followed up. Globally, the disease has now been confirmed in 200 countries and territories. So far, there has been over 800,000 confirmed cases, over 38,000 deaths, and over 170,000 recoveries. Senegal, our closest neighbor, reported 175 cases, that's confirmed cases, and 40 recoveries. The media briefing done daily is to keep the public updated with the most recent COVID-19 related developments in the Gambia. The public is therefore urged to play its part by reporting any suspected cases through our toll-free lines on 1025, following the preventive measures and complying with the executive directives. All media platforms are being actively engaged in the dissemination of sensitization materials and credible information, for which the ministry also appeals to the general public to follow. We are getting reports that various individuals and groups, including the Markas, the Numial community, and even some of our health workers, are being stigmatized and discriminated against for the mere fact that they either have had a positive case from amongst them, or in the case of the health workers, provided services to positive cases. They should be stopped, and people should be encouraged to come out and be tested and undergo quarantine for the protection of all. The people who are infected or affected deserve our compassion. It is a disease. It is not by their own fault that they are infected or affected. Therefore, they need to be treated with a lot of compassion. After all, we do not know who is going to be affected or infected next. So therefore, all the people who are infected or affected, we appeal to the general public to treat them with a lot of compassion and understanding and support. Finally, the Ministry of Health appeals to the general public to remain calm and vigilant. We continue to thank our security forces for being vigilant and alert. We are happy that they continue to intercept many people who enter the country and attempting to evade quarantine. Recently, 8 individuals who came by road from Sierra Leone were intercepted in Upper River region, and they are undergoing quarantine as we speak to you. It has also come to our notice that a lot of people use boats, fishing boats and other boats, to evade the immigration officials, to evade the border posts, and come into the Gambia through illegal entry points. We urge all our citizens to be vigilant, to protect the Gambia's borders, and to report any of such cases, because a single case could mean disaster for our communities when they are not detected on time, when the necessary measures are not taken to ensure that if they are infected, the infection is controlled in specialized centers. So we urge the population, the general public, and all individuals to ensure that such cases are reported, to ensure that we are all vigilant and make sure that our borders are safe. People do not enter our towns and villages from places without being authorized to do so. Any suspected individual should be reported to the authorities for necessary action. Every Gambian and resident of the Gambia has a role to play, and together our collective efforts will enhance the containment of COVID-19 in the Gambia. Once again, I thank you very much for your attention.
Thank you very much, Honorable. Well spoken statement. Now we will go into the next session of the press briefing. That is, now we have delivered his statement. We'll go into the question and answer session. And I also want to hand over that baton to Boubacar Sankano to facilitate that. Mr. Sankano, you can kindly facilitate that.
Thank you very much, Director Modinga, and thank you very much, Honorable Minister, for those reassuring words. Before coming to the question and answer, allow me to make a summary on behalf of our Sarafule listeners and viewers. As we are coming from URI, Kenya Mare Mwakuni, Gambia Mansakunda Tohon, Minister Ngarahundeko, Kenya Nyatono Okilun Tohomedi, Albalau Nganari, Ontatu Aga campaign of Kube, Aga Katikube Nui, Imadu Tewu, Isagohe, Alandanya. Orakibare Mugu, Nanti Ho Kubenuga Markaz Kedi, Aro Mare Mukubenuga Numiel, Aro Dingratana, Iganaga Nokusu, Soronga Nyakia, Soronga Suenia, how to Nantina Albalau Amanya Hinan, Alawai Sueni Serenga Lenki, Kumane Anankita, as Minister Kenya Kon Antona me Onokilun Tomedi, Harsa Kenyani, Onokilun Tomedi Ondua. Okir Sekebegani, Alhamdulillah Lenki, Ajarandi Kaitununda Koy Nanti, Wahasun. Adimbaya, Mansabi Topotono, Avishorgono, Allagano Dema, or Gemesahaba. Kenyani Maremo, Kendangi Hale, frontier in Debuku, Ono Kilunto, Kenagane, Onahigabe, Mukungu, Nunguniendi, Amakura, Kenya, the Besuga frontier in Gambia, Jaman Selang, Anan Kilunto, Kenyani, Wakatisu Mogabu, Ogarafa. Both companies in Gasigra, Albalak Barendi, Ondua, Omar Mugudomi. On that note, open the floor for these 2 or 3 questions. You're welcome. Raise your hand and then you may announce your media outlet.
By the head of the state. It has been said that it has to be used into buying of cars and that of the test kits regarding that of the fighting of the COVID-19. On that note, we've heard that maybe other places like the Republic of China has donated some test kits and that of vehicles to that of the Gambian government, which is also part of some of the itineraries we have mentioned, the 500 million is going to be put into. Can you just tell us exactly whether still now you are going to go ahead buying those stuff still now which has already been there as donations, or still now you're going to do the money for something else? My second question is going to be like that of the Chinese Republic of the People's Republic of China donations were allegedly being denied by other countries like Netherlands and that of Spain and that of Turkey, saying that their products are 30% accurate when it comes to that of the rate it is actually having. Is it sure, or am I going to have you on record that it is actually not going to do any harm to the Gambian people if we are to continue using those donations from the Chinese Republic of the People's Republic of China?
Very much. I guess I don't know if you are here. Yes, the day before yesterday, we did answer the question with regards to what the $500 million is the government pledged, what it will be spent on. And it is not just test kits. Managing an epidemic, a pandemic, it requires more than just procurement of test kits. A host of activities are involved. The sensitization costs money. Sensitizing the people need to be sensitized. You need to print sensitization material, posters, billboards, radio shows, advertisements, getting people moved from one area to the other, the communities, the Kanyelen groups, the talk show hosts, and so on and so forth. All these need to be taken care of, and they need funds. Now, capacity building, COVID-19, people need to be trained. Training materials need to be procured. The training itself will cost some money, of course, sending people across the length and breadth of the country to go and train the healthcare workers everywhere they are. As we speak, the teams are going around. I think they are in Basse now, training people as to what to do. People need to be trained as to what they need to do to deal with the COVID-19, even though they are healthcare workers. Even the putting on of gloves, the putting on of protective equipment, people need to be trained as to what to do. The protocols, the management, even when they get the patient who is suspected, how to deal with that, the people need to be trained. If a positive case is detected, how to treat that positive case, how to interact with that positive case, people need to be trained. So the training is very, very, very important as well. These people need to be given psychosocial support. And there are people who are going around giving that psychosocial support to these people. Now, you forgot that there are also people who are under quarantine. They are staying in hotels, isn't it? Those hotels have to be paid for. It is not free. The hotels have to be paid for, and then the people have to be fed as well. You realize that we say there are 247 people in various hotels in the country. Each of those individuals have to be fed, and they have to be housed, and the hotels are paid for. Now, a host of things. Of course, you need vehicles to move people around. If there are cases, people need to travel in vehicles to go around to pick those cases, to do the follow-up, to do the contact tracing. So that is also very, 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 very important. And, you know, if you remember when we started, we told you there are 6 thematic areas. The coordination is part of that. The case management, part of that. The risk communication, behavior change, community engagement, and all part of that. The case management is part of that. The logistics, you have to buy protective equipment. You have to buy gowns, you have to buy gloves, you have to buy a mask, you have to buy sanitary materials, soap, buckets, taps, and so many other things have to be procured. So, and then we also mentioned that the staff at the forefront need to be given allowances, for their extra work. They've been working around the clock to make sure that they deal with the emergency. Some of them hardly ever sleep. They need to be compensated to some degree. Of course, no one can ever pay health workers enough. The work is risky, we all know. It's very risky. The things that people are running away from, the health workers endeavor, they go there to meet those things. People are afraid of the droplets. They deserve to be given allowances, and inshallah they'll also be given allowances from these funds. So it's a host of things. So the Chinese donations are helpful, but believe me, you do not even know whether those donations are going to be enough, because we don't know how far this thing is going to go. We pray it doesn't get overwhelming, but certainly we cannot tell for sure how the trend it is going to take. Now, your second question was? Yeah, so the Chinese test, I think people should try to refrain from speculation, especially things that we are not sure about. If other countries rejected the donations, I'm not aware of that, but I'm also aware that a whole lot of other countries received these donations, right? And when these test kits are given, the standard practices, when you get test kits, you test them. You do what we call quality control. You test them against the already existing test kits, and then you standardize. And every now and then the test kits, the tests that are done using these particular new test kits, you use other test kits to do the same test to see whether really they are good enough. So the laboratory scientists are very aware of what to do, and really we also see no reason why China should give test kits that are not good enough, really. and the personal protective equipment, so that is to protect our personnel. So I think we should appreciate the donations, especially this time of scarcity when developed countries are struggling to even get the resources that we have been donated. And I think we should extend our sincere gratitude to the people who donated this item. Yeah, 2 days ago we did mention people, for whatever reason, I sincerely do not know why people want to misinform the population. What goes in their minds when they deliberately know that they do not have sufficient information, or they do not have the correct information, or the information they have is not verified, and they inform the population. And I think it is not just misleading, it is very sinful for people to talk about things they know nothing about. A few days ago, many of us heard of the WhatsApp message going around saying that the medicines China gave, the injections, when the people of this country are injected, it is disastrous. Some countries rejected that, and the person has no clue of what was given. It's so unfortunate, causing panic in the country, maliciously and sinfully, of course, because there are no medicines in those donations. He didn't even know. So I guess some of you also, when you hear that, you don't wait for the minister to counteract that. You counteract it because you were there at the airport when they were donated and you saw the list. So don't keep quiet on those things. The media too, you need to be proactive. Counteract information, especially that you yourself, you have evidence against. So I think, especially at times like this, when we need collective efforts, this is not a single person's problem. We have seen what it is doing in other parts of the country. I think we should be supportive. And believe me, we want to use the opportunity to also thank the people who have been so supportive. We've got a lot of Gambians in country and in the diaspora who have been showing immense support. Immense support to ourselves, our team members, and to all the people who are participating in this endeavor to contain this disease in the Gambia. They've been sending supportive messages, they've been praying for us, they've been encouraging us. Believe me, we want to tell them that their messages are hard, and each time we get such a message, we don't even want to sleep. We want to get out there collectively to deal with this challenge. Thank you very much.
I would like to give the chance to the Director of Public Health Promotion to elaborate on that.
Thank you very much, Honorable, for that elaborate statement, and the response was very good. And in fact, I just want to add one or two things, which is also we talk about the money. The minister is also thinking of strengthening and also expanding the points of entries. We know we have 9 official points of entries. Out of the funds also, there will be also construction of other additional points of entries, and also minister is also thinking of having a specialized area for quarantine center. That's also in his plan. Also another plan is also to strengthen the National Public Health Laboratory. And if you know, if the lab, we want our own laboratory to be functional. How do you make it functional? You need to get the equipment, you need to get the reagents, you need to get almost all sort of materials, and these are expensive materials. So these are all part of the plan, and then for sure, and you will see some of these structures being available in the country, and these are all part of the support. This I want to add to what, in addition to the list he has provided to you. And as you know, capacity building is very expensive. If you look at other equipment that came, like PPEs, are very, very expensive. So all those things are part of the cost. So if you look at health in general, if you look at money and you look at the equipment in health, healthcare service delivery is very, very expensive. So, but with all that, he's also thinking of how do we move from one level to the other. So the points of entry will be strengthened. Also the plan is to get a functional quarantine center and also a functional public health laboratory, so that you can also be able to do all kinds of tests. That's also one of the things I want to add.
Thank you very much, Director. Just to emphasize what the Minister said, I can assure you that the Minister believes in transparency. Even before coming here, he talked about it. Transparency, and Director Modunjai, we complain about a lot of challenges we face, but we insist that no matter how slow it is, we follow the due diligence. We went to Basse without allowance, without risk allowance, without per diem, and we came by that. He has to take the money from his own pocket to buy breakfast for us. So we are not waiting for money, we are not waiting for any 500 million, we are sacrificing on the front, using our own meager resources. And be rest assured that the figures are there, you have people under quarantine, how much it costs, and then you'll all be not. Be rest assured that with the minister in charge, transparency will be done, all these details will be clear along the line. You can take the next question.
Yeah.
Yeah, Minister want to...
Well, thank you very much. And so, for a repeat, you were not here the last time. The equipment for the facilities is also going to be bought from that. So the facilities across the length and breadth of the country are also going to be strengthened to be able to deal with these cases and subsequently for health system strengthening. So a lot of equipment also going to be procured very soon. We are hoping that we get this equipment in the next couple of weeks. Inshallah, we'll get equipment here. People are behind the scenes negotiating to get ventilators, to get the monitors, to get the oxygen concentrators, to get a host of equipment, medical equipment, laboratory equipment that are going to strengthen the health facilities in this country for the COVID-19 and thereafter, so that the systems are strong enough to deal with what needs to be dealt with. We are very pleased to inform you that we have put in robust systems in place to monitor the use of these funds. It's not business as usual. Last week, we inaugurated a committee. The committee comprises of members from the Ministry of Health, Ministry of Finance, very high level, from the Permanent Secretary and support staff, Ministry of Finance, Permanent Secretary and support staff, the Accountant General, the Director of Internal Audit, the Director General of Gambia Public Procurement Authority. I inaugurated this committee, and this committee has been tasked with the responsibility of the disbursement of these funds, so that this committee, the establishment has a number of advantages. One is the fact that because items need to be procured very quickly because it's an emergency situation, and these are the people through whom the various approvals have to be sought. So if those people all are at the same table discussing these things, you realize that it will be expedited. But the other advantage is that there will be transparency from the beginning. They will all look at what is requested from the various partners, from the various groups. They will look at it, discuss it, argue over it, disagree over it, and eventually agree as to the best practice. So you see, this type of committee is unique, and this is how we are dealing with these issues. Now, funds are not given to Ministry of Health directly. There are government procedures that are followed. When these funds are allocated, they go through stringent processes. So an account has been opened at the central bank called Special Projects Account, so that these funds are not even mixed with the ministry's routine funds, so that they can be tracked easily. So what is spent will be easy. The click of a button, you can see what has been spent and what is left, and then the funds are being disbursed following stringent processes through the Accountant General's Department, through the Treasury. They have put there an accountant whose job is to deal with these funds at the Accountant General's Department. So we have very stringent processes that are put in place already for the disbursement of these funds, and at regular intervals we are going to monitor it directly ourselves to see how the expenditure is. So be rest assured that this government believes in accountability and transparency, and that is very important. For that reason, a lot of partners are very confident, and we've seen a whole lot of support from partners because they've seen that we have put in robust mechanisms to make sure that whatever is brought for this COVID-19 program, for this COVID-19 response, is judiciously utilized. It has enhanced the confidence from the ordinary people in the Gambia, from donor partners, and they all want to come on board to facilitate, because they know that there is a very strict process that needs to be followed for us to respond to this crisis. Thank you.
Next question. One more last question. All satisfied for the day? That's very interesting, huh?
One of the first interventions by your ministry, we monitored the other day, we went there even at night. So could you update us as to the work on the border side, the entry points, what is the number in terms of people screened, and what is the threat to our quarantine centers? We've seen now people coming from Senegal, allegedly dodging the coronavirus there. So does it have any bearing with the number of people we have in quarantine centers in the Gambia?
Yeah. Yes, we have some people, though few, who came from Senegal, and they were taken to the center. I think two young people were taken to the center yesterday when they came in from Senegal. But I think we all know that the borders are closed. So the borders are closed, that means they are closed. People are not allowed to come in or to go out except you remember the exceptions as well. People who need to go for medical reasons, who need to travel. Well, when I say medical reasons, for example, a referral, a patient who is referred from one part to the other, or if they are accompanying essential goods, including drugs, for example, a truck carrying drugs and so on and so forth, and probably security personnel. Those are the kinds of exceptions. So the borders are closed. Now, our challenge is that the borders are porous. The borders are very porous. You know that there are some border villages that have part of the village in Senegal and the other part in the Gambia. So that is a big challenge. So that's why we have been asking the communities also to be vigilant. And we're getting a lot of support from the communities. When they see people, I think the communities are aware that the efforts of government are geared towards protecting the whole country, of course the communities included. So they are alerting us when they see such cases. Recently at Tanje, a number of boats from Senegal were returned. Were returned by the Navy. The Navy is intercepting a whole lot of boats, carrying passengers at various points. In Banjul here, even in Katong, we had similar things going on. And more so Tanje, that has become a very big illegal entry point. The Navy is there patrolling and returning, intercepting vehicles. But we want community participation. Because when people come from Senegal, usually they also come to people here in Gambia. So let's discourage them. Let's discourage hosting them, and so that to ensure that this trend doesn't continue, because it can have an impact on our control measures. Thank you. Okay, if you do not have
what will be your message to those with those
I don't think I in any scientific evidence as to that. To strengthen one's immune system to be able to fight COVID-19. So my advice is, if one is taking garlic, garlic is food item, isn't it? If one is taking garlic, to flavor food and for other reasons, I'm not saying the person should stop. But if one is taking garlic for the purpose of preventing or curing COVID-19, I've seen no evidence pointing to supporting such assertions. So it's difficult for me to say garlic is good or it's not good. But what I know and what is said is that there is no treatment, as we know, for COVID-19. That is why the prevention, the preventive mechanisms that are in place should be enhanced, and to ensure that the communities, our families, and ourselves are all protected. Thank you very much. Thank you.
That brings us to the end of today's, daily update on the Honorable Minister. See you tomorrow. Honorable Minister, at one of the TV stations would like to make a message, 1 minute statement. What do you like him to pronounce? Yeah, what do you want him to say? Come.
No, it's just fun.
Oh, is it fun?
Yeah.
You want to have a separate interview?
No, it's fun.
Okay. Okay. We can.
Yeah.
Okay.
Thank you very much. Thank you, all of you. Yeah. Good. How is it?
My fellow Gambian brothers and sisters, this is a message of precaution, solidarity and hope. We living in very unusual times. The coronavirus is a menace that's threatening all of us, but together, united, we can do something about this. First, we need to take necessary precautions and take expert advice and act accordingly. Stay away from crowded places, wash our hands, and use hand sanitizers where necessary. Let us remain calm and hopeful. There is a God, that God is alive. Allah will take care of us, but we have to take the necessary precautions. There is a number that can be called to report and to ask questions. Let's use it. Together, we can fight this menace, and we know Allah subhanahu wa ta'ala will be there for us. Let's remain calm and hopeful. Inna Allaha ma'as sabirin. Let's be patient, calm, take precaution, and do the right things. This is a message from your brother Mamadou Sabali. Assalamu alaikum wa rahmatullah.